welcome back to our colonoscopy preparation podcast series. I am Bimal Muharjan, here once again to guide you step by step as you prepare for a colonoscopy. Leveraging my journey as a GI patient, this series aims to simplify and demystify the colonoscopy process for everyone involved. As always, our advice is anchored in the latest medical standards and guidelines provided by esteemed health organizations, combined with first-hand accounts and recommendations from gastroenterologists. Our goal is to blend professional guidance with personal insights to ensure you receive both scientifically sound and practically useful information.
Disclaimer: GusFair is not a healthcare provider or a clinical firm. We offer self-help GI care tools and resources designed to empower you in managing your gastrointestinal health, all at your specific direction. Our platform and our services are intended to complement, not replace, professional medical advice and treatment. Always consult with a healthcare professional for medical concerns.
Last time, we discussed T minus 14 days before your colonoscopy, focusing on understanding and preparing your prep kit. We talked about how to pick up the right prep kit tailored to your specific health needs, where to pick it up, and how to manage side effects that might arise during its use. Our podcast series is meticulously organized to guide you through very critical milestones leading up to your colonoscopy. Today, we are advancing to episode 3, which zeroes in on T minus 7 days mark, adjusting your medications and ensuring everything is lined up for the upcoming procedure. In this episode, we will dive into the essential adjustments you need to make a week before your procedure. We'll cover everything from which prescription medications to continue or pause to managing medications for specific conditions such as heart or liver issues. We will also discuss how to ensure reliable transportation for the day of your colonoscopy. Stay tuned, and by the end of this episode, you will be well equipped to make informed decisions about your medication and have your logistics firmly in place. We are here to help you navigate these adjustments smoothly, ensuring that you approach your colonoscopy day with confidence and peace of mind. So let's start. The first question is, which prescriptions should I continue and which should I pause before my colonoscopy? As we get closer to your colonoscopy, one of the key preparations involve adjusting your prescription medications. Not all medications are the same, and the decision to continue or pause them isn't one size fits all. It's about understanding which medication can affect the procedure and how. First, for anyone taking blood thinners, such as warfarin, clopidogrel, or daily aspirin for heart conditions, it's typically necessary to pause the medication to reduce the risk of excessive bleeding during the procedure. Your doctor will give you specific instructions on when to stop taking these medications, often a few days before colonoscopy. Second, if you are on diabetic medication, especially insulin or sulfonylureas, that can lower your blood sugar, adjustments might be needed because you will be on a clear diet before your procedure and there is a risk your blood sugar could drop too low. Your healthcare provider might recommend reducing your dose or altering the timing of your medication. Third, for medications related to blood pressure, heart conditions, or thyroid disorders, in most cases, you'll continue taking these right up to the day of procedure. However, always verify this with your doctor, as stability in blood pressure and heart rhythms are crucial. For those On medications for mental health, such as antidepressants or anti-anxiety medications, these are generally continued to maintain emotional and psychological stability. Yet, it's important to discuss this with your healthcare provider, particularly how they might interact with your anesthesia. In summary, the key to managing your prescription medications before a colonoscopy is a clear communication with your healthcare provider. They will guide you through which medications to pause, which to continue, and how to safely make these adjustments. By carefully managing your medications, you are setting the stage for successful and complication-free colonoscopy. Let me move on to the next question. How should I manage my medications for heart conditions such as hypertension or atrial fibrillation in preparation for the procedure? Managing heart conditions medications as you prepare for colonoscopy requires careful planning and consultation with your healthcare provider. Here's what you need to consider. Firstly, for hypertension medications, is essentially it's generally recommended to continue these medications right up to the morning of a colonoscopy. The goal is to maintain stable blood pressure throughout the procedure, which helps prevent any cardiovascular complications. Common medications such as beta blockers, AC inhibitors, or calcium channel blockers should be taken as usual with a small sip of water, even in the morning of your procedure. Secondly, if you are dealing with atrial fibrillation, particularly if you are on blood thinners like warfarin or neuroanticoagulants such as dabigatran or apixaban, the approach might be a bit different. These medications often require adjustment to minimize the risk of bleeding. Typically, your cardiologist may advise you to stop these medications a few days before the procedure, depending on the risk of stroke and the type of anticoagulant you are using. This decision is crucial and should be made in coordination with your gastroenterologist and cardiologist. So, in conclusion, if you are managing a heart condition, the key takeaway is to never make changes to your cardiovascular medications without professional guidance. Always coordinate these adjustments with your cardiologist and gastroenterologist to ensure a safe and effective colonoscopy. Staying on of your heart health is as important as preparing your colon for the procedure. Now, let me move on to the liver conditions. Are there any specific considerations for medications if I have liver conditions such as cirrhosis or hepatitis? So, dealing with liver conditions like cirrhosis or hepatitis adds an extra layer of complexity when you are preparing for a colonoscopy. It's crucial to ensure that your liver can handle the medications involved both and before the procedure. For those of you navigating liver conditions, adjusting your medications before a colonoscopy involves several key considerations. First, if you have cirrhosis, you need to be especially careful with medications that are metabolized by the liver. This includes many over-the-counter pain relievers such as acetaminophen, which generally safe in limited amounts. It can be harmful in large doses or when liver function is compromised. Yet doctors might adjust the doses or recommend alternatives that are safer for your liver. Second, for conditions like hepatitis, if you must also consider the impact of medications on your liver's current state. Non-steroidal anti-inflammatory drugs, NSAIDs, which are often advised against before procedure due to their blood thinning effects, can also cause liver damage if used inappropriately in patients with liver disease. Third, it's essential to review all medications including herbal supplements and vitamins with your healthcare provider. Some substances might exacerbate liver conditions or interact poorly with prescription medications you are taking for liver health. So, when preparing for colonoscopy with a liver condition, the bottom line is to work closely with gastroenterologist and possibly a hepatologist. They will guide you through safely adjusting your medications to protect your liver while ensuring colonoscopy can be performed effectively. Remember, each step is adjusting your medications should be taken with an eye toward safeguarding your liver health. Let me talk about stomach conditions. Should adjustment be made to medications for acid reflux, ulcers, or other stomach conditions? Adjusting your stomach medications isn't just about comfort, it's also about creating the safest environment for a successful colonoscopy. For those dealing with stomach conditions, the approach to adjusting your medications need careful considerations to avoid exacerbating your symptoms and to ensure lining of your stomach is protected. Firstly, if you are on proton pump inhibitors, PPIs, or H2 blockers for acid reflux or GERD, typically, you can continue these medications up to and including the day of your colonoscopy. These medications can help maintain a stable stomach acid level, which is beneficial for reducing the risk of discomfort during fasting and the procedure itself. Secondly, for those with ulcers, medications such as PPIs are crucial in maintaining the protective lining of your stomach, which can help prevent bleeding. It's usually recommended to continue these medications without interruption. Third, if you are taking any antacids or alginates during alginate drugs like gaviscon, you can generally continue these as needed up to a day before the procedure. However, it's important to avoid any medications containing aluminum or magnesiums within a certain time frame before the colonoscopy, as these can interfere with the visibility during the procedure. In summary, if you are managing stomach conditions like acid reflux or ulcers, it's essential to continue your medications as prescribed to ensure the integrity of stomach linings is maintained. Always discuss your specific medication regimen with your gastroenterologist as you prepare for a colonoscopy. Their guidance will ensure that your medications are optimized to support both your condition and the success of the procedure. Let me move on to the diabetes, including weight loss medications like Ozempic. What modifications are necessary for diabetic medications, including insulin and your weight loss medications? Managing diabetes effectively requires careful attention to medication, and this becomes even more crucial as you prepare for colonoscopy. It's like recalibrating your approach to your blood sugar levels to ensure that they are stable, safe during fasting required for the procedure. Fine-tuning your diabetes medications isn't just about tweaking numbers. It's also about ensuring a balance that keeps you safe during your colonoscopy. For those of you with diabetes, adjusting your medication regimen before a colonoscopy is essential to avoid both high and low blood sugar levels, which can complicate the procedure and your recovery. Firstly, for insulin users, the key is to adjust your doses to compensate for the lower intake of food, especially while you are on a clear liquid diet the day before procedure. Your healthcare provider might recommend reducing your insulin dose to prevent hypoglycemia. For example, if you use long-acting insulins, your dose may be decreased by as much as 20 to 50% the day before colonoscopy. Secondly, for those taking oral diabetes medications such as metformin, you may need to adjust or even skip doses. This is particularly important since some of these medications, including metformin, can increase the risk of lactic acidosis if you become dehydrated during the prep. Third, regarding newer weight loss medications like Ozempic, which is also used to manage blood sugar levels in type 2 diabetes, you should consult with your healthcare provider. Typically, medications like Ozempic, which can affect gastric motility and insulin secretion, may need to be paused temporarily to prevent gastrointestinal side effects and hypoglycemia during the fasting required for colonoscopy prep. To wrap up, if you are managing diabetes, it's crucial to discuss your specific medications with your endocrinologist or diabetes specialist before your colonoscopy. They can provide personalized advice on how to adjust your insulin and any other diabetes medications, ensuring you remain stable and safe throughout the procedure and recovery. Let me move on to kidney conditions. What adjustment should be made to my medications if I have kidney conditions such as chronic kidney disease or I am on dialysis? Are there specific PrEP solutions that are safer or recommended for patients with kidney issues? The dealing with kidney conditions such as chronic kidney disease or being on dialysis puts you in a special category that needs customized care, especially when it comes to preparing for colonoscopy. Firstly, regarding medication adjustments, if you have kidney disease or are on dialysis, many medications might be taken for other conditions. Dealing with kidney conditions such as chronic kidney disease or being on dialysis puts you in a special category that needs customized care, especially when it comes to preparing for colonoscopy. Firstly, regarding medication adjustments, if you have kidney disease or are on dialysis, many medications you might be taking for other conditions will need a second look. Medications that are cleared up by the kidneys could build up in your body and potentially cause toxicity if not adjusted. For instance, certain blood pressure medications or diabetes medications may need to be reduced or skipped depending on your kidney function and dialysis schedule. Secondly, concerning the PrEP solutions for the colonoscopy, it's crucial to avoid those that can be particularly harsh on kidneys. Traditional osmotic laxatives that contain sodium phosphate should generally be avoided because they can significantly alter your electrolyte and fluid balance, which is dangerous for those with kidney issues. Instead, polyethylene glycol solutions are often recommended because they are considered safer and less likely to affect kidney function or electrolyte balance. In summary, if you are managing kidney conditions, make sure to consult closely with your nephrologist or your renal specialist about which medications need adjustment and the safest PrEP solution for a colonoscopy. Tailoring these elements to your specific needs is key to ensuring a safe procedure and optimal outcome. Now, let me move on to other chronic disease conditions such as autoimmune disorders, respiratory conditions, thyroid disorders, mental health conditions. Let me start by autoimmune disorders. Should I make any changes to my medications for autoimmune conditions such as rheumatoid arthritis or lupus? Managing autoimmune conditions such as rheumatoid arthritis or lupus typically involves medications that can affect immune function and inflammation. It's crucial to consult with your rheumatologist or healthcare provider about these medications before a colonoscopy. Commonly, medications such as neo-steroidal anti-inflammatory drugs, NSAIDs, might be paused due to their potential impact on bleeding. However, Immunosuppressants such as methotrexate or biologics may be continued based on your doctor's assessment of a disease activity and overall health. The goal is to maintain disease control while minimizing procedure-related risk. Respiratory conditions. How do I manage medications for asthma or COPD in preparation for my colonoscopy? If you have asthma or COPD, maintaining optimal respiratory function is essential. You should continue using your inhalers, nebulizers as prescribed. However, if you're on oral corticosteroids or other systemic treatments, discuss with your pulmonologist whether any adjustments are necessary. The key is to ensure that your respiratory condition is stable as possible to avoid complications during the sedation and procedure. Your healthcare provider might also recommend a pre-procedure bronchodilator treatment if you're prone to bronchospasms. Next, thyroid disorders. Are there considerations for my thyroid medications, especially if I have hypothyroidism or hyperthyroidism? For patients with thyroid disorders, it's generally advised to continue medications such as levothyroxine without interruption. These medications are crucial to maintaining your metabolic balance and do not typically interfere with colonoscopy procedures. However, if you have concerns about your thyroid condition stability, such as in cases of hyperthyroidism, consult with your endocrinologist. The focus should be on maintaining a stable thyroid function leading up to and during the procedure. One last, mental health conditions. Can I continue my psychiatric medications such as antidepressants, anti-anxiety meds, or mood stabilizers? Again, managing mental health is vital, and you should generally continue taking your psychiatric medications as prescribed, including antidepressants, anti-anxiety medications, and mood stabilizers. These medications help maintain your mental and emotional stability, which is particularly important when facing a medical procedure. However, because some psychiatric medications can interfere with anesthesia, it's important to discuss all medications you are taking with your gastroenterologist and anesthesiologist. They may make specific recommendations or adjustments to ensure safer procedure. Let me now move on to supplements, the specific considerations for chronic conditions. Are there supplements should I avoid due to my chronic disease, such as those might interfere with medication efficacy or procedure safety? Let me start with vitamin supplements. Which vitamins are safe to continue and which should be stopped, particularly those that might affect bleeding or healing? When preparing for a colonoscopy, it's important to consider how certain vitamins might interact with bleeding and healing processes. Vitamin K. Vitamin K plays a crucial role in blood clotting. Generally, it's safe to continue taking vitamin K as part of multivitamin or in your diet unless you are taking blood thinners like warfarin. In such cases, keep your vitamin K intake consistent to avoid interfering with medication effectiveness. Vitamin E. Vitamin E has natural blood thinning properties. It is usually recommended to stop taking these high dose vitamin E supplements a week before your procedure to reduce the risk of excessive bleeding. However, the small amounts in multivitamins or diet are typically not a concern. Omega-3 fatty acids. Like vitamin E, omega-3 supplements, often taken for heart health, can thin the blood. It's advised to stop taking these supplements 7 to 10 days before your colonoscopy to minimize the bleeding risk. Iron supplements. Iron supplements are often stopped several days before a colonoscopy because they can darken the lining of the colon, potentially obscuring the view during the colonoscopy. This is particularly important if you are being evaluated for sources of bleeding in the intestine. Herbal supplements. Many herbal supplements, including but not limited to garlic, ginkgo biloba, and ginger, have blood thinning properties. It's best to discontinue these type of supplements at least a week before your procedure to avoid any risk of being risk of bleeding. So, maintaining a balance in your vitamin intake is key as you prepare for colonoscopy. While some vitamins are essential and safe to continue, others, especially those with anticoagulant properties, should be paused. Always and always discuss your specific supplements and dietary habits with your healthcare provider to tailor your preparation safely and effectively. This careful planning ensures that you are in the best possible conditions for your colonoscopy, minimizing any risks associated with bleeding or visibility during the procedures. Let me also talk about some common supplements that we take: probiotics, fibers, prebiotics, symbiotics. The question is, should I pause probiotics or any fiber supplements prior to my colonoscopy? And if so, when? When gearing up for a colonoscopy, adjusting your intake of dietary supplements that affect digestive health, such as probiotics, fibers, prebiotics, and symbiotics, is important for a few reasons. Fiber supplements. Fiber supplements, especially those containing bulk-forming agents such as psyllium husk, should be paused for before colonoscopy. These supplements can interfere with the bowel cleansing process by creating residue that coats the colon wall, especially obscuring visibility during the procedure. And timing, it is typically recommended to stop taking fiber supplements at least 5 to 7 days before a procedure to ensure that colon is clear. Probiotics. Probiotics are generally considered safe to continue as they do not affect the clarity of the colon. However, since they are meant to populate the gut with beneficial bacteria, their effects can be negated by the bowel cleansing needed for colonoscopy. Therefore, some healthcare providers might recommend pausing them a few days before the procedure. And the timing, if advised by your doctor, stop taking probiotics 3 or 4 days prior to your colonoscopy. Prebiotics and symbiotics. Like prebiotics and symbiotics are used to enhance your gut health. Since these can also contribute to residue in the colon, it might be suggested to pause them along with fiber supplements. And timing, stopping prebiotics and symbiotics should align with stopping fiber supplements about 5 to 7 days before a colonoscopy. In summary, while supplements such as probiotics may not necessarily be paused, fiber supplements, prebiotics, and symbiotics should be discontinued several days before your colonoscopy to ensure a thorough and effective bowel cleanse. Always check with your healthcare provider for personalized advice based on your specific health needs and the type of supplements you're using. Properly managing these supplements will help ensure that your colonoscopy goes smoothly, providing your doctor with a clear view of your colon. So let me move on to another very common section and questions about herbs and spices. The question is, are there herbs or spices I should avoid due to their potential impact on blood clotting or hydration levels? When preparing for a colonoscopy, it's important to consider the effects of certain herbs and spices that might influence blood clotting or hydration. Blood clotting. Some herbs have natural anticoagulant properties which can increase the risk of bleeding. Notably, herbs like garlic, ginkgo, and ginseng should be avoided as they can thin the blood. It's recommended to stop using the herbs at least 1 week before a procedure to ensure they don't complement the process by increasing bleeding risk. Hydration. Spices such as cayenne pepper, which might cause diuresis or mild hydration, should be used cautiously. While they generally do not need to be completely avoided, it's wise not to consume them in large quantities before a procedure to maintain optimal hydration. How about specific herbs such as ashwagandha, turmeric, ginger, etc.? Do these common supplements such as ashwagandha, turmeric, or ginger need to be discontinued, and what are the reasons? Number one, ashwagandha. This supplement is generally recognized for adaptogenic properties and doesn't significantly affect blood clotting or hydration. However, because it can interact with other medications and potentially influence blood pressure and sugar levels, it's prudent to discuss with your healthcare provider whether to continue or pause it as your colonoscopy approaches. Turmeric. Known for its anti-inflammatory properties, turmeric can also thin the blood due to its curcumin content. If you are taking turmeric supplements, particularly in high doses, it's advisable to discontinue their use about a week before colonoscopy to prevent any potential increase in bleeding risk. Ginger. While ginger is beneficial for digestion and nausea, it also has a mild blood thinning effect. If you are using ginger supplements, consider stopping them a few days before procedure to avoid exacerbating any bleeding issues. In summary, while herbs and spices are commonly used for their health benefits, the impact on blood clotting and hydration can be significant when preparing for a colonoscopy. It's essential to evaluate your use of these supplements and discuss them with your healthcare provider. Stopping herbs can affect blood clotting, like turmeric and ginger, at least a week before your procedure, and moderating the use of others that impact hydration will help ensure a safe and effective colonoscopy. Next, allergy medications. The question is, can I continue taking my routine allergy medications, or are there any that might interfere with the procedure or anesthesia? For routine allergy medications, including antihistamines and steroid nasal sprays, can be continued as they generally do not interfere with anesthesia or the colonoscopy procedure itself. However, it's important to discuss all medications, including over-the-counter allergy remedies, with your healthcare provider. Some antihistamines can cause drowsiness or interact with sedatives used during the procedure, so your doctor may recommend adjusting the timing of your doses. Now, how about NSAIDs or painkillers? Which NSAIDs and painkillers should I avoid due to their blood thinning properties, and when should I stop taking them? Non-steroidal anti-inflammatory drugs, commonly known as NSAIDs, such as ibuprofen, naproxen, and aspirin, should generally be avoided before a colonoscopy due to their blood thinning effects, which can increase the risk of bleeding. It is typically recommended to stop taking these medications 5 to 7 days before procedure. If you need pain relief during this period, acetaminophen, Tylenol, is a safer alternative as it doesn't have the same blood thinning properties. And let me discuss additional concerns for chronic diseases, especially about managing flares or symptoms. The question is, what precautions should I take if my chronic conditions flare up during the preparation period? If you have a chronic condition that flares up during your preparation for a colonoscopy, it's crucial to contact your healthcare provider immediately. They may need to adjust your medications or take any steps to manage your symptoms safely. It's also important to maintain a hydration, especially if your preparation involves bowel cleansing, which can be dehydrating. And obviously, for colonoscopy, bowel cleansing is required. Hence, you must maintain your hydration and contact your provider immediately. The next section is about emergency contact. The question is, should I provide information about chronic conditions to the medical team in case of an emergency during the procedure? Absolutely. It's essential to inform the medical team conducting your colonoscopy about all chronic conditions you have. Provide a detailed medical history and a list of medications that you're taking, including doses and schedules. This information can be crucial in managing any complication or emergencies that might arise during the procedure. Another very important question is, should I stop smoking, drinking alcohol? Yes, It's advisable to stop smoking and refrain from drinking alcohol at least 24 hours before colonoscopy. Smoking can affect blood flow and wound healing, while alcohol can interfere with anesthesia and increase the risk of bleeding. Stopping both can help ensure a safer and more effective procedure. For example, I don't drink and smoke. I don't make a judgment for other people, but what we have known from the health perspective is that smoking and drinking both are harmful for our health. That's pretty much clear. So make your own judgment, but at least for procedure perspective, you should stop at least 24 hours in advance before the procedure. Now let's talk about more logistical one, transportation and support. Because it's 7 days before the colonoscopy, it's advisable to arrange for a transportation and the support that you need. So these sections help you to think through transportation and support. And let me go through Q&A one on one. The question is, how long after the procedure will I need someone to be with me? After a colonoscopy, it is essential that you have someone with you for at least 24 hours. The sedatives used during the procedure can impair your judgment, coordination, and reaction times, making it unsafe for you to drive or operate any machinery. Additionally, having someone nearby is important in case there are complications or if you experience adverse effects from the anesthesia. Can the person driving me wait at the facility or will they need to come back to pick me up? Again, this can vary by facility, but generally the person driving can wait at the facility if they prefer. Some facilities have lounges or waiting areas for drivers. However, due to space or policy limitations, they might be asked to return later. Check with your specific facility beforehand to adjust their policies. Again, in my case, it was during the COVID time. There were, even though it was social distances in place, the hospital I had the colonoscopy had enough waiting areas, so my wife could wait during the procedure. Again, the procedure wasn't that long; it's an hour long, so waiting might be a viable choice rather than going out and coming back again. Next question is, what arrangements should I make for my ride home if I'm using a ride service or public transportation? If you are planning to use ride service or public transportation, it's advised to arrange this in advance. Ensure the service is available at the time you're likely to be discharged and inform them that you will be recovering from sedation. It's best, however, to be accompanied by a friend or a family member, even if using these services, as you may still be feeling the effects of anesthesia. Are there services available through the hospital or clinic to assist with transportation if I can't find a driver? Many hospitals and clinics can arrange or help arrange transportation for patients who do not have a driver. Contact the facility ahead of a procedure to inquire about these services. They may be able to provide or suggest local options that ensure you get home safely. What instructions or information will my driver or accompanying adult need to know on the day of the procedure? Your driver or accompanying adult should know the details about the timing of the procedure, estimated duration, and the discharge procedures. They should have contact information for the medical facility and understand that you may need assistance getting home due to sedation. Additionally, they should be prepared to monitor your recovery immediately after the procedure for any signs of complications. So after this transportation support, let me move on to the next section, which is general procedure preparations. Should I prepare any document or medical information to bring me with on the day of the procedure? Yes, you should bring a list of all medications you are currently taking, including supplements, any relevant medical history documents, and your health insurance information. Also, bring any referral notes or instructions from your doctor. The next question is, how should I dress for the procedure, and are there any items I should bring for discomfort or necessity? Dress in a loose, comfortable clothing that is easy to remove and put on. You will likely be asked to change into a hospital gown for the procedure. It's also a good idea to bring a list of your current medications, a small blanket or throw if you tend to get cold easily, and a book or magazine or any for any waiting periods. And avoid bringing valuables or jewelry. As we wrap up today's episode, I want to thank you for joining me on this important journey through your T-7 days preparation for your upcoming colonoscopy. We have covered a lot, from how to adjust your medications safely to ensuring you have the right support and transportation arrangements in place. It's all about making sure you're prepared as possible, reducing stress, minimizing any risks during the procedure. We discussed the critical assessments for various chronic conditions and how to handle medications that can impact your procedure outcome. Remember that the key takeaway from today is communication. Keep in close contact with your healthcare providers about any changes in your conditions or concerns you might have as your procedure date approaches. Your safety and comfort are paramount, and proper preventions can make all the difference. And one more reason, and one final time, I want to reiterate this. The purpose of this podcast or this episode is not to tell you which medication to take and which not to take. The purpose is to give you a general framework so that you know, and give you some examples so that you know what what you need to do, and most importantly, what questions you need to ask categorically to your doctor, be it your gastroenterologist, cardiologist, nephrologist, hepatologist, and any other specialist who you are working with, so that you have clear instructions, answers before you go before you go for the procedure. And looking ahead, in our next episode, we will move even closer to your procedure day, focusing on T-5 days mark. We will dive into specific dietary adjustments and what you should expect in final days leading up to your colonoscopy, and how to manage last minute anxieties or concern. Stay with us as we continue to guide you through each step of your colonoscopy preparation. Thank you for your trust and attention. Here is to the smooth and successful colonoscopy. See you next time.